Kris Jenner's new appearance has created a massive media stir. What operation made her look so amazing? Well, she's revealed her plastic surgeon, and it's pretty obvious that she's undergone at least her second facelift. But was it really a deep plane facelift like people are claiming? Well, what the heck is a deep plane facelift anyway? And as a real holistic plastic surgeon, would I recommend it? Well, let's break it down on this video today. Kris Jenner's face has gotten everyone talking about what she may or may not have had done, and social media experts are claiming that they actually know.
Why are deep plane facelifts so expensive, and why doesn't every surgeon offer these?
To achieve this sort of transformation in someone in their late 60s, this would likely involve a deep plane face and neck lift.
So is this true? And what makes a deep plane facelift different than other facelifts? Well, facelifts are operations that are meant to lift the lower face, the neck, and to a lesser extent, the cheeks. So if you have jowls or loose skin of the lower face and neck, this operation basically lifts it. And there is truly no alternative to a well-done facelift. Now, there are three main causes of aging of the lower face. Our skin gets loose and it sags as we get older. We also get unwanted fat pockets, most commonly fat that sags below the jawline that we call the jowls, and the fat that accumulates underneath the chin. And the muscle of our lower face and our neck also droops, and we call this the platysma in the neck, and the extension of the platysma in the lower face is called the SMAS. Now, you may see your friends who are maybe a bit older than you, and they've got these vertical bands in their neck which move when they talk, or maybe when they make certain expressions. And these are called platysmal bands. Now, the only procedure that treats all three of these issues, the sagging skin, the unwanted fat pockets, and the drooping muscle, is a facelift. During a facelift, the plastic surgeon makes incisions in front of and behind the ears. That surgeon then elevates the skin, removes the unwanted fat or repositions it, and then tightens the underlying muscle layers. All of the different facelift techniques involve removing a similar amount of skin and repositioning or removing the unwanted fat pockets. Honestly, they aren't all that different in regards to the skin and the fat. But where they differ is how they treat the muscle layer, or the SMAS. The loose SMAS can be cut out and the edges stitched back together, called a SMASectomy, or it can be folded over itself and sutured tighter, called a SMASplication. Now, studies haven't shown any of these techniques to be superior to each other. The results really vary depending on the quality of the surgeon and the aging of the patient. So then what is a deep plane facelift? The deep plane facelift was originally described by plastic surgeon Dr. Sam Hamra back in 1990, and it was called the composite facelift. The idea behind this operation is that instead of lifting the skin and then reshaping the fat and then tightening the muscle, all of this done separately, in the deep plane facelift, once that skin is elevated several centimeters, now that's the green part of this diagram, incisions are then made through the SMAS muscle layer, and the dissection is then performed underneath the muscle so that the skin, the fat, and those muscle layers can be elevated together as one big composite flap. And this is the purple part of the diagram. So the term deep plane refers to the plane of dissection underneath that SMAS muscle layer of the face. Now, Dr. Hamra lectured extensively for decades about this deep plane composite facelift operation. And although the results were really impressive, honestly, most plastic surgeons didn't follow in his footsteps due to the high risk of complications with this extensive operation. And the one that we worry about the most is the risk of motor nerve injury. So you see, when the surgeon dissects below that SMAS muscle in the deep plane, they're in the same plane as the nerves that supply the muscles of the face. So they have to be extremely careful when they operate in this plane, because one minor wrong move could lead to disaster. If the surgeon accidentally cuts or cauterizes a branch of the facial nerve, it can result in facial paralysis. And this usually presents in the patient, meaning you being able to move one side of your mouth, but not being able to move the other side of the mouth. And you can get essentially a crooked smile afterwards. Now, one meta-analysis found the composite facelift had a 1.5% chance of temporary nerve injuries like this. And honestly, that is really scary. So the higher risk of a potentially devastating complication is why a lot of plastic surgeons, including myself, don't perform the deep plane or the composite facelift. So why then is the deep plane facelift so popular? Well, there are some very experienced and skilled plastic surgeons who are performing the deep plane facelift with honestly fantastic results. Their belief is that by dissecting in the deep plane and elevating that skin, fat, and muscle together, it may have a longer lasting result with less risk of skin healing issues and less risk of pore scarring. However, these beliefs have not been conclusively proven to be true. Also, because the deep plane facelift has a lot of hype on social media, some plastic surgeons are charging astronomical amounts to perform the operation, some charging upwards of $150,000 or more for this surgery.
Bruh.
This high surgeon's fee is an incentive for other plastic surgeons to perform the operation, maybe over a potentially safer alternative? Well, in my opinion, if you're considering a deep plane facelift, I think it's a very valid and powerful surgery, but buyer beware. Make sure your plastic surgeon is very experienced and skilled in the procedure. You don't want somebody who dabbles in the deep plane facelift to dabble on it on you. So what do I do? Well, as a holistic plastic surgeon, my goal is to give my patients the absolute best result with the least amount of surgery and the least amount of risk. I perform my own smash plication facelift, which is a combination of techniques I learned during my training in Beverly Hills and developed myself after performing nearly 1,000 facelifts in my career. It's safe, it has great results, and has a faster recovery time than some of the more aggressive, invasive facelift operations being performed today. It's basically a safe, real, holistic plastic surgery facelift with great results. So what about Kris Jenner? What type of facelift did she have done? Well, contrary to what a lot of people are claiming, it's not clear that she had a deep plane facelift. In fact, I think it's actually unlikely. Her plastic surgeon, Dr. Stephen Levine, has been quiet about it, but there are some clues. This comment from a facial plastic surgeon in New York City and another facial plastic surgeon both confirm that Dr. Levine does not perform deep plane facelifts. His mentor, Dr. Daniel Baker, was actually famous for his smashectomy facelifts and was never actually known to do a deep plane facelift. So we don't know exactly how Dr. Levine did Kris Jenner's facelift, but on the surface it appears that she did not have a deep plane facelift. Facelifts come in all types, and what's important isn't necessarily whether it's a smash plication, a smashectomy, or a deep plane, but the skills of the surgeon performing the operation. Studies are clear that one type of facelift isn't necessarily better than another, so if you're considering getting a facelift, meet with your individual board-certified plastic surgeon and discuss what's right for you. Well, if you want to learn more about Kris's facelift and why I think she looks so good, check out this video where I break it all down for you. It is 4 specific factors that make Kris Jenner and her photos look so incredibly young. And as always, remember to eat real food, use clean skincare, and auto-rejuvenate before you operate.